Let's do FAQs on buttock implants. So let's go one by one. We sort out the questions that were most frequently asked on Google, and let's answer these questions to the best of my abilities. Let's go. Here's the first one. Pain. Pain is something that is so subjective that it's difficult to answer. But speaking objectively, initially, more than pain, what you feel is stretching. Whenever we put an implant anywhere in your body, you're going to feel the stretch of the muscle, the skin, the other structures that are there in the body. There is a little bit of pain, especially when we put it inside the muscle or over the muscle, because the muscle is also affected a little bit. It may go into a little bit of spasm. But we are going to be giving you painkillers that are going to go on for at least a week. By then the muscles relax. We are going to be giving you muscle relaxants if needed as well. So all of these help to manage the pain, and they are not something that makes you, lie around the whole day and you can't do your work. The pain is manageable, and it's something that usually patients don't really complain about much, and it settles most of it by maybe about 3 to 5 days. Which is longer lasting, implants or fat? It's a very interesting question. Now, one thing that you have to understand with implants compared to fat is that they are not going to change their shape. They're going to be as they are, but they will not change as per your anatomy or as per aging. So they are definitely going to be longer lasting than fat. However, when you age and say if your body sags a little bit, you may need to change the size or the shape of the implant. With fat, one thing is that once it's in, whatever survives after 3 to 6 months is usually what you get for long term. However, if you lose weight or if you gain weight, the shape of the fat put in your buttocks will change. So it's a tricky question as to what lasts longer. If you're someone who's going to gain weight or lose weight, or someone who does this very easily, fat is something that may affect the shape of your buttocks and you may not like it and you may need to remove it if it increases too much when your weight increases, or if it can disappear as well when your weight goes down. Whereas an implant, whether you increase or decrease your weight, will stay the same. However, with aging, this implant may not be the right fit for you and you may need to change it maybe 10-15 years down the line. So what is longer lasting depends from patient to patient. So we had a very curious case where we had a patient who came and asked us, why are the charges for the buttock implants like about 2 times or 1.5 times more than for the breast implants? Well, these are the charges that the manufacturers charge us, and so they are. There are reasons for that. What is the difference between a buttock and a breast implant? One of the main things is that breast implants are basically what are called as, they have a silicone exterior and a silicone gel interior. There are buttock implants most of the times that we use are similar. They have a silicone gel exterior, a capsule, and a silicone gel fluid, sort of a gel thing that is on the interior. However, in the buttock implants, these are much more denser, much more stronger, and much more what are called as form stable. That is, it does not sort of change their form. This is important because a buttock implant is much harder compared to a breast implant. So you can sit on them, for long hours and still they'll retain their shape. With breast implants, it is not something that they are made for. Breast implants are made more so that they look natural when your breasts move and when they feel what you feel in your breast. So they are different because they are meant for different purposes and in different areas of the body. We do not use breast implants for your buttocks or buttock implants for your breast. One other very important thing is that there are what are called as biconvex implants that are present for your buttocks, but they are not there for your breast. So biconvex implants, if you need a lot of projections, you can use for your buttocks, but we don't have something similar for your breasts. There are similarities in the shape, in the sizing, in that they have anatomical implants and there are round implants and things like that, but they are not the same. Can your implant rupture? The answer is yes. It's very rare, but it can always happen. It does not happen with the newer generation of implants, whether it be buttock implants or breast implants. But one very important thing is that this silicone, the gel inside, it's not in the fluid state. It is what is called as form stable silicone, in the sense that even if we cut your implant, even the breast implant that is softer, not just the buttock implant, and you sort of do this with the shell, the gel will not flow. The gel stays there. Many a times, if the implant shell is ruptured, there's something called as a capsule that the body forms around the silicone implant, and this ruptured gel it sort of stays there inside this capsule. This, unlike the previous or the older implants where the silicone would leak out and get into your bloodstream and into your bodies and cause other major complications, the newer generation of implants don't have this problem. So this was the first part of our FAQs on buttock implants. There we found so many questions that people are asking. We're going to do a part 2 soon.